Hi, Alvin here, and you are watching episode 48 of the 3-Minute Health Tip. And in this episode, I'm going to talk about unexplained knee pain. Now, when we're talking about knee pain, we first have to rule out any physical trauma or a mechanism of injury, just like any joint. So if you ever wake up with a swollen knee and some pain in your knees, you want to first identify whether the day before you injured it somehow, playing a sport, falling, twisting it while you're going for a walk, missing a sidewalk step, anything of that nature that causes some pain, and then the next morning you wake up and it's swollen and the pain has gotten worse. So obviously you want to rule that out. But in this episode, I'm going to talk more about unexplained knee pain, which means there was no mechanism of injury. You did not injure the knee physically, but one day you wake up and it's swollen and it's painful, sometimes to the point that you can't walk on it or you have to limp. Looking at unexplained knee pain, we're going to look at it again using the science of G&M and the 5 biological laws, which means there's an organ involvement, there's a brain involvement, and there's an emotional conflict involvement when it comes to the knee pain. When we're dealing with knee pain, we're discussing or talking more about the joint itself, the muscles, the tendons, the ligaments around the knee. And those organs or those body parts are controlled from what's known as the cerebral medulla. That's the control center. And what it is that affects the cerebral medulla are often unexpected conflict shocks that's known as a performance devaluation. A performance devaluation is where you devalue your ability to perform something. You didn't run fast enough. You couldn't walk fast enough. You missed your bus. You didn't play well in that game. You didn't run well today. You were slower than you normally perform. So it could be an actual performance devaluation where you devalue your ability to perform in a physical activity, or figuratively, it could be a performance where you felt you were too slow. You couldn't keep up. You weren't fast enough to do something in your life. So these types of conflicts that occur unexpectedly affect the brain that creates physical changes in the knee that we experience as knee pain or swelling. However, the pain and swelling only show up when you resolve the performance devaluation. So oftentimes it's when you actually performed well that the next day you will start to get that knee pain. Just a great example of this is one patient I remember in his 60s who was fit and healthy. He was actually an athletic director at a school. He golfed regularly, worked out regularly, went for a run, played basketball, volleyball, all sorts of sports. But I remember he dealt with a heart issue for a few weeks. And so the doctor made him wear a Holter monitor to monitor his blood pressure, his heart rate. And so during the period of the few days that he was wearing his Holter monitor, he would still attempt to work out and go to the gym. However, he was told not to work at the level of intensity that he normally would go and work at. So instead of a level 7 on the treadmill or on the Stairmaster, he would have to perform at a level 3 or a level 4 in order not to get his heart rate too high, in case it was an issue with his heart. And so this was a real conflict for him because he didn't expect that it would bother him, that it would make him feel like he was wasting his time at the gym. 2 days later, when he no longer had to wear this monitor and he could go back to the gym and perform at the level that he normally could perform at, which is a level 7 on the treadmill or the Stairmaster, he now resolves the performance devaluation. He felt great. He couldn't believe how good a shape he felt. There was no issues with his heart during this period. The next morning, he wakes up with swelling and pain in his knees. So again, it's important to understand that that didn't come because of arthritis, because of old age, because he must have done something. Again, when you rule out a physical trauma as a mechanism causing the pain, we have to look at where is it that we're devaluing our performance in something. Is it that I went out with friends for a hike and I was too slow, I was holding everybody up, I can't believe I'm out of shape, I can't keep up? Is it that I decided to take the elevator, instead of taking the elevator 5 flights to my office today, I took the stairs and I was so winded, I was so out of shape, I devalued my ability to climb the stairs. And the next morning or 2 days later or 3 days later, when you feel good about it, now you have knee pain. So it's important to understand where is it that I'm devaluing my performance and make those connections, be conscious of it so that you can close that biological program and get relief from that knee pain. So the key thing to remember, be kind to yourself, be kind to your knees, look at your ability to perform things and allow it the time that it needs to heal. I want to thank you as always for your attention, and I look forward to seeing you at the next episode.